Welcome back to the Dr. Jeffrey Tauth Heart Talk Show, and today's show is called Dr. Jeffrey Tauth Tauth Cardiomyopathy Risk Revealed. And trust me, it's juicier than your cousin's peach cobbler. Listen up, folks. Every 36 seconds, someone dies from heart disease in this country. That's faster than it takes most people to tie their shoes. But here's the kicker. There's one heart condition out there killing thousands of Americans, and 90% of y'all can't even pronounce it, let alone recognize it. I'm talking about cardiomyopathy, and if you just stumbled over that word, don't worry, you're in good company. But by the time we're done here today, you're going to know this silent killer like your own middle name. So what exactly is cardiomyopathy? Think of your heart muscle like a bouncer at a fancy club. Normally, this bouncer is strong, flexible, and knows exactly how to handle the crowd. But with cardiomyopathy, something goes haywire. Your heart muscle starts getting thick like a bodybuilder on steroids, or it stretches out like an old rubber band, or it gets stiff as a board. None of these are good news for keeping the blood flowing where it needs to go. Now, here's what makes this condition scarier than a horror movie marathon. Unlike a heart attack that hits you like a freight train, cardiomyopathy creeps up on you slower than molasses in January. We're talking years of your heart muscle quietly changing while you're going about your business, completely clueless that there's a problem brewing. There are three main types you need to know about. Dilated cardiomyopathy makes your heart blow up like a balloon at a kid's birthday party. Sounds fun, but trust me, it's not. Hypertrophic cardiomyopathy thickens your heart walls like they're trying out for the WWE. And restrictive cardiomyopathy makes your heart stiffer than your back after sleeping on your in-laws' couch. Yep, entirely true. I can't make this stuff up. Now, who's walking around with a target on their back? Well, if you're a man over 50, especially if you're African American, you just moved to the front of the line. And gentlemen, I know you think you're invincible, but your heart didn't get that memo. Family history? That multiplies your chances by 5 to 10 times. So if your daddy or granddaddy had heart problems, maybe I should see you in the clinic. We need to talk. High blood pressure, diabetes, and obesity are like sending out party invitations to cardiomyopathy. And here's what really gets my stethoscope in a twist. Most of my patients don't show symptoms until this condition is already doing the electric slide all over their heart muscle. Let me tell you about Sarah. 45 years old, teaches third grade, loves those kids like they're her own. Sarah started getting winded walking up the stairs at school, but she figured she was just out of shape. Hey, we've all been there, right? Then the fatigue hit her like a ton of bricks. But Sarah's a trooper. She blamed it on work stress, maybe those late nights grading papers. 3 months later, Sarah's in the emergency room thinking she's having a panic attack, and guess what the doctors find? Her heart is blown up to twice the normal size. Twice. That's like trying to stuff a watermelon into a lunchbox. The real heartbreaker? If Sarah had caught this early, we could have prevented years of damage to her ticker. So what are the warning signs your heart is crying for help? First up, shortness of breath during normal activities. If climbing a flight of stairs leaves you huffing and puffing like the big bad wolf, that's not normal aging. That's your heart sending up a flare. Unexplained fatigue that doesn't get better with rest is another red flag. I'm not talking about being tired after a long day. I'm talking about feeling like someone unplugged your battery charger. Check your legs, ankles, and feet at the end of the day. If they're puffed up like marshmallows, your heart might not be pumping efficiently. And chest pain or irregular heartbeat during exercise. That's your heart's way of saying, Houston, we have a problem. Here's what I need you to do. And I mean this week, not next month when you remember. If you're over 40 or have family history, schedule that heart screening. Don't wait for symptoms because by then we might be closing the barn door after the horse has already galloped off into the sunset. Early detection isn't just about finding problems. It's about preventing irreversible damage to the muscle that keeps you alive. Your heart's been working 24/7 since before you were born, and it deserves a little attention, don't you think? This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy, and remember, if you're looking for answers, check out drjeffreytauth.us.com. Later, y'all.